Welcome, everyone. I am Denise Solzbach, pronouns she, her, hers, and I'm the director of the National Center at the Institute for Innovation and Implementation at the University of Maryland, Baltimore School of Social Work. I want to thank you for joining today's Managing Now for a Better Tomorrow conversation. Today's conversation, as you know, is on adapting ways of practice to support LGBTQ youth. We will be tweeting throughout this discussion. If you'd like to join us, please use the hashtags BetterTomorrow and TA Network Talks and tag us at Institute UMSSW. We recognize this is a challenging time for all of us and appreciate you taking the time to join us today. Together, we can create lasting solutions to address social justice and race equity in order to build a better tomorrow for all children, youth, young adults, and their families. We have developed these conversations to create peer-to-peer opportunities for you to talk with presenters as well as one another. We encourage you to continue to use the chat box to share your thoughts and resources as well as questions for the presenters. We see that you all are pretty good at using that chat. Please keep it up. When you use the chat box, please select all participants. This will allow everyone to see what you are sharing. Sometimes folks tend to check attendees or panelists, but all participants will get us to everybody. In follow-up to today's conversation, we will be sending everyone who registered a link to today's recording, as well as all of the resources you share with one another in the chat box. So please keep them coming. And this will very much be a conversation today. You'll see our presenters, you can see them in the top row on the screen, joining us from their homes and their offices today. And for most of the discussion, we will not be using a PowerPoint. And because this is truly a Managing Now About Tomorrow discussion series, again, we want to emphasize that we thank you for participating. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building that brighter tomorrow. This conversation that we're having today, I believe, is our 14th or 15th in a series. We have prior recordings available. They include on crisis communications, in-home behavioral health, supporting families, residential interventions, rural health, infant and early childhood mental health, mobile response and stabilization, supporting students both from the perspective of educators and school administrators, as well as families and students, as well as housing and homelessness. To view our recordings of past discussions as well as receive other resources and updates, please go to the institute.umaryland.edu/COVID. As we said, today's conversation is about adapting new ways of practice. We are joined today by a panel of experts to help us engage in a dialogue about adapting our work to remote delivery and to talk about how providers are thinking about reopening safely based on local conditions and how we may adapt these services to better meet the needs of LGBTQ youth of color. And now it's time to meet today's panelists. Today we're joined by Angela Weeks. Angela's preferred pronouns are she, her, and hers. She is our colleague at the Institute for Innovation and Implementation at the School of Social Work at the University of Maryland, and she is the project director for the National Quality Improvement Center on Tailored Services, Placement, Stability, and Permanency for LGBTQ2S children and youth in foster care. Hi, Angela. We're also joined by Allison Del Percio, preferred pronouns she, her, and hers. Allison joins us from DC, where she's the director of All Children, All Families Human Rights Campaign. Hi, Allison. We're also joined by Kathy Lazier. Kathy's pronouns are she, her, hers. Kathy is with the Human Services Collaborative, and she's the coordinator of the TA Network and SAMHSA's national work group to address the needs of LGBTQ2S and their families. And Kathy also is part of the TA Network and joins in our Cultural Linguistic Competency Hub. Also joining today is Sarah Rosso, preferred pronouns they, their, them, theirs, and she, her, hers. Sarah joins us from Pittsburgh, where they are the executive director at the Hugh Lane Wellness Foundation. Welcome, Sarah. Also joining us from Pittsburgh is Coley Alston. Sorry about that, Coley. The preferred pronouns are they, them, theirs, and they are the program director and a firm interventionist at the Hugh Lane Wellness Foundation. Welcome, Coley. And from Canada, we have Shelley Craig joining us today. Preferred pronouns she, her, hers. Shelley is with the Canada Research Chair in Sexual and Gender Minority and Youth Professor and Purveyor of Affirm, which we'll hear some more about today. And finally, Christopher Balanci, preferred pronouns he, him, and his. Christopher is the Vice President of Policy and Practice and Chief Medical Officer at Harvard Medical School at Judge Baker's Children's Center. Christopher also serves as the Medical Director for the TA Network. Welcome, Christopher. Thanks for joining us. And with that, I'm going to turn it over to Angela. Thank you.
Great. Thanks, Denise. Thanks for kicking it off for us. And hi, everyone. Thank you for joining us today. So as Denise said, my name is Angela Weeks, and I'm the Project Director for the Quality Improvement Center for LGBTQ Youth in Foster Care. I appreciate the ability to have these conversations with you all today. This series in general has given us an opportunity to have conversations about how specific populations have been impacted throughout this pandemic, and how we might be able to adapt services to meet the needs. So now we get to have this discussion as it relates to LGBTQ youth. And so with my project, we are implementing 15 different interventions for LGBTQ youth and their families, and we have been doing that for a few years now as part of a larger federal grant. And that's quite a lot of interventions to be implementing. Our purpose is to look at what's working for this population and what isn't working for this population by evaluating these programs and then giving recommendations to the field. And so when COVID-19 hit, we took a minute to breathe and process and figure out what was going on. And we listened to scientists and realized that they were projecting this could be the situation for quite some time. So we had to make some pretty swift decisions about how we were going to be providing services for our population. We decided to go and try to move all of our services to virtual platforms relatively quickly. And our experience has been that we have certainly met some challenges in doing that, but we've also experienced some really positive outcomes, some of them completely unexpected by moving to the virtual world. So we are, I think that we're grateful that we had the opportunity that we could provide services virtually, because we see that they're sort of opening up and we're being able to serve people in different ways that meet different kinds of needs, and we're also able to serve more people. So there are definitely some positive things we've been experiencing. But as we do this work, and when we initially started to translate our interventions virtually, we had to consider what are the unique circumstances that this population might be experiencing. So the first thing that sort of came to our mind was that many young people would be isolated at home or isolated in environments where they did not feel comfortable to be themselves, where they couldn't disclose their diverse SOGI or sexual orientation or gender identity, or they could be isolated in spaces where they were experiencing rejection from their families or from the other people around them. And so this happened even pre-COVID-19, right? But young people were able to access services outside of their living spaces, wherever they were. And they might have been getting support through their school's GSAs or through friend groups or other just outside services. So now that isn't the case, we have to think about how do we get services to them in their homes where potentially they're not, they might not feel comfortable to talk about their identities in the first place. And for our project, we focus very much on SOGI identity through all of our interventions. And so we had to also think about privacy. How do we deliver these programs in homes or potentially in unsupportive environments and still safeguard that young person's privacy? Will they feel comfortable enough to have these conversations if other people are in earshot? And so these questions were really important to think through, because we know for, even pre-COVID, for LGBTQ youth that were in unsupportive environments, their rates of depression and anxiety and suicidal thoughts and all kinds of other unhealthy health outcomes, they increase for this population. So we wanted to be really thoughtful around this. And actually, you know, privacy around telehealth and teleservices in general is something that we've all, I think, been thinking through quite a bit. So I'd love to hear from people in the chat. If you could chat in your, you know, what have you been doing to safeguard your clients' privacies as you have been providing teleservices or telehealth? That would be great to hear what other folks have been doing. But we, you know, a few things that we tried right off the bat was making sure everyone had headphones. That's sort of like an easy step. So making sure that they were getting the equipment they needed to have privacy in that way. But also having conversations about privacy before they engaged in services. So asking them, what does your space look like? Do you feel comfortable? Where might you be able to have a private conversation? And just coming up with sort of privacy planning before services engage. And the other thing that you know, we had talked to folks about doing is maybe having a code word with the participants that you were talking to, so that if someone did come in the room that they weren't comfortable with, they could say their code word or give the signal, and that clinician could change the subject or end the call. So those are just a few things, and my colleagues have more ideas as well, but we were thinking through these pieces and trying to be really thoughtful about it. The other thing that we had to think through was access to technology. So all of our programs are being implemented in for young people and families involved in foster care. So we had to think, is everyone going to have a computer or tablet? Many of the families and young people that we're working with might not have consistent internet service, might not have data plans on their phones, right? So how do we get that technology to them? So we've had to work with, you know, our counties that we're working with and different agencies we're working with to try to provide the needed technology. But also the Children's Bureau has put out some flexibility in the way that we can use our funding to purchase technology for young people and families. So this is something that we're figuring out. We're sort of still navigating, but that's definitely a huge piece, obviously, for virtual services, is to make sure that people can have the right technologies to engage. But once they get the right technology, they also have to know a little bit about using the technology, which can also be a challenge for people who may not be regularly holding Zoom calls in their houses. So one of the things that we've done is our practitioners have now also become technology consultants. They will call families and youth ahead of time and work with them on how to access the platforms before services start. The Institute for Innovation and Implementation, where this project is housed, also created 2 short animations that we're going to share with you in the chat. One is on how to use tablets for Zoom meetings, or how to access Zoom meetings through tablets, and the other one is how to access Zoom meetings through computers. So we created these short animation videos for the young people and families engaged in our interventions, because we thought they might be more accessible than the stuff that you sort of find on the Zoom website or through other tutorials. So feel free to use those if they're helpful to you, and share those with your organizations. I think they've been helpful tools for us so far. But those are the pieces, right? And that's just not just only for this population, but those are just the things that we had to sort of kickstart to get these interventions running. And now we've had some interventions that have been virtual for a few months. And so we have some of our interventionists here on this panel today who will discuss what that experience has been like and some of the successes and early challenges. But so, you know, again, I just really appreciate the opportunity to have this question. And there are unique circumstances for LGBTQ youth, as I mentioned, but we also want to make sure that we're thinking about youth of color who are LGBTQ, and primarily during this time, Black LGBTQ youth, because they're going through what people are often calling a pandemic within a pandemic. There's lots of things that are going on right now that we should be factoring into the way that we're providing services. And so we actually have Kathy Lazier on today, who has been working with our project as a partner and consultant, but has also centered a lot of her focus on intersectionality and on cultural humility. And I'd love to just toss this to Kathy for a bit to hear your thoughts on just what should folks be thinking through as we're providing services to Black LGBTQ youth in particular during this time? What are some things that folks should be just keeping in mind?
Can you hear me?
I can.
Great. Thank you, Angela, and thank you for inviting me to be part of this important conversation. Like many of you on this call and on this meeting, I live in a world of intersecting identities, and having navigated through my childhood, my education, my career as a person of color, I'm having to create this hierarchy of identities. First, I'm a woman, then a biracial, half Filipino, half white person, a lesbian, experiencing discrimination at these multiple levels. And now with COVID-19, I've been identified as a high-risk person because of my age, which absolutely enters into my hierarchy of identities. Intersecting identities have come into clearer focus with Black Lives Matter protests and the racial justice movement, and with COVID-19. And we're seeing and hearing about the disparities and disproportionalities that exist for Black and brown people. And we all know that this is not the first time. The latest data reveals continued deep disparities by, most notably for Black and Indigenous Americans. For example, African Americans comprise 13% of the population in the US, yet 23% of the COVID-19 cases are African American individuals. Hispanics make up only 18% of the US population, but are 33% of the COVID-19 cases. And Black Americans continue to experience the highest overall mortality rates and the most widespread occurrence of disproportionate deaths. I heard it reported for specific populations this way, that if they had died of COVID-19 at the same rate as white Americans, at least 14,400 Black Americans, 1,200 Latino Americans, and 200 Indigenous Americans would still be alive. We've known that African Americans are more likely than whites to die of diabetes, have a higher prevalence of hypertension and heart disease, that Black children are 4 times more likely to be admitted to the hospital for asthma, and we know that underlying health conditions put you more at risk of COVID-19. So Black and brown people are also at higher risk of infection, as people of color comprise a large portion of our essential workforce through direct contact with the public, and these workers include our LGBTQ youth. But what's interesting is while states have documented the coronavirus, the uneven toll on certain demographic groups, although even that's not always consistent, because with Asians and Indigenous Americans, they're often lumped together in some states in the other category. But most public health officials aren't tracking whether it's disproportionately affecting the LGBTQ community. I've only heard about 2 states who've added SOGI identity on COVID-19 data collection. Pennsylvania did back in March, and California, where last I heard there was a bill to count LGBTQ people in COVID data, and it's waiting to be signed by the governor. That's the last I heard. It may be updated by now. LA County is now collecting SOGI data for COVID-19. So we'd love to hear if it's something that you as a state or as a locality are collecting. We do have data that show youth who identify as LGBTQ+ and a person of color, as Angela said, are more likely to experience increased racial harassment, lower academic achievement, missing school because they felt unsafe, increased risk of homelessness and suicide. And while white youth still die at a higher rate by suicide, the rate of Black youth suicide is increasing faster than any other racial or ethnic group. Last summer, the American Academy of Pediatrics, and Christopher might be able to speak to this more, warned that racism and discrimination can have devastating long-term effects on children's health, including stress, anxiety, anger, depression, higher rates of doctor visits, lower self-esteem. Even the anticipation of discrimination can trigger this minority stress response. So we know that, teenagers who were more stressed are more likely to drink, smoke, experiment with drugs, and we know that LGBT youth report higher rates of substance abuse, higher rates of sexual risk behaviors, increased risk for HIV/AIDS. Just to wrap up, we're going to hear from the other presenters and panelists, and we want to hear from you on how your organization is addressing the unique stresses of LGBT youth of color. It's an uncertain time, this time of COVID-19. It's a time of heightened attention to racial injustice, and it's a time that we are adapting practices, and we're moving to more social media, as Angela said, platforms and mobile technologies. Have you been implementing additional trauma approaches? Has your agency taken a hard look at its priorities, including examining its own systemic and structural racism? Health organizations have a roadmap for this. It's the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare, also known as class standards. And this helps to create and address this plan of health equity. So lastly, I think an important question to ask is, as you adapt to new ways of practice and you're moving forward, is your agency's leadership and staff listening and questioning kind of with a real intentional intersectional lens? And if not, why not? So that's those are my thoughts on this. Thanks, Angela. Turn it back to you.
Thanks, Kathy. Yes, and for those that might have looked away from the chat box for a minute, we did upload the class standards that Kathy just mentioned, and those are a great starting place if you're trying to figure out what you should be looking at in regards to, just practicing equity in general. So definitely take a look at those. We got a couple of questions. One of them was from Alyssa Snyder, who asked if we think the assessment around, I think this is what you're asking, Alyssa, so please do clarify, around like assessing their privacy and assessing what feels comfortable to them as far as telehealth services should also still continue to happen even as people might transition back to in-person services. And I think, yes, absolutely. Having privacy and safety plans with young people and assessing that at the forefront is absolutely important, whether they're in-person or virtual services. So that's a great question. And then LaDonna Barner asked a question about using text-based services. And then if we know if this is okay regarding HIPAA, which I'm actually going to ask Christopher to elaborate on sort of HIPAA guidance during this telehealth time.
Thank you. So HIPAA has relaxed some of the requirements. I think if you're going to be building a virtual platform for doing work with LGBTQ youth, you're probably best off trying to start by using a HIPAA compliant platform so that when the pandemic ends, or at least some of the state of emergencies end, and the relaxation may be withdrawn, you've already established a protocol or a system that is HIPAA compliant. So I'm going to put into the chat box a resource that has all of the listings of HIPAA compliant technologies that the Institute has pulled together. I think a lot of people are using DoxyMe or WebEx or Zoom. I'd be interested in what other platforms folks are using and what you know about whether or not it meets HIPAA compliance. You can just chat those into the chat box. I know there were lots of concerns about Zoom. There was problems with people Zoom bombing and using very problematic language. They have tightened that up so that you can do invitation only. You can lock the room once you have all your participants in the room. So there are ways to try to make it as secure a technology as possible. And I see folks are using Google Meets. That's another very popular platform. Microsoft Teams, I think, is another one I've heard about. So I think there's the technology piece, and then there's the creating the safe space, which Angela talked about in the introduction so effectively.
Thanks, Christopher. One of the big things I think that's great about this series is that we're also talking about what do we do now, managing for a better tomorrow, what's the next steps. And I'm really excited to toss this conversation to Shelley next, because Shelley is the creator of one of our programs that we are implementing through our project called Affirm. And this program was primarily being implemented, or only being implemented and evaluated as an in-person intervention. And then very quickly, I think it was the first one out of the gate for us to switch over virtually. And Shelley is actually the first person I know of to have any data around, does this work virtually? So that's really exciting. And Shelley is going to talk us through that now.
Perfect. Thank you so much, Angela. And thanks, everybody, for being here. And also, I just know for all the folks on the call, certainly the presenters, but really the folks on the ground, you're working really hard to support your families and your youth through this difficult time. So I just want to give you all props, because I know that's really challenging to do. I'm going to very briefly try to go through just a little bit of an overview of one of the programs that Angela is talking about. And Affirm is a program that I will talk about. I am one of the creators. And Affirm is the first evidence-based intervention created specifically for LGBT youth. It addresses a range of mental health issues, and it's CBT based. We worked with community, took us about 10 years to create it, and I am now in Canada. It is being implemented a lot of different places, but in Canada, I'm in the middle of a randomized controlled trial. So I'll be talking a little bit about data related to that. The goals of Affirm, again, it's an 8-session brief intervention, about 1.5 to 2 hours long each week. The goals of Affirm are to decrease unhelpful thoughts, so some of the structural biases and some of the unhelpful thoughts, what we used to call maladaptive coping, but we don't anymore, so a little stigmatizing, and to help young people feel better about themselves and their lives, and to cope in ways that really affirm their identities and support making healthy choices. So let me keep, okay. So we've had, Affirm has been running in the trial for about 3 years now, and on March 17, the state of emergency was declared in Ontario, so that's what the province in where I live, and all of the agencies that were hosting Affirm basically froze. They could no longer hold groups. So we are sort of the purveyors and the creators, but we work very closely with community groups to help increase their capacity. And so 4 days later, I brought the team together of our folks, and I said, look, we have to figure out how to do this and to offer this online as quickly as possible. And so March 23rd, we essentially started to launch Affirm online. We rapidly got ethics approval. And the reason, of course, that we had to launch quickly online is because we certainly know, and I think the previous presenters really talked really well about this, the stressors, the additional stressors that LGBT youth are experiencing at home, again, being in hostile family environments in many cases, the need for increased support, related to their mental health, the increased isolation. So what we did is we had 5 groups that were happening in the community, and we provided an opportunity for each of those groups to then move online. So we had these sort of meet and greet meetings with the young people. They had all had either between 1 to 3 meetings offline of the 8. So that's an important thing to know. They had, in fact, met each other. Most of them had met each other in person about 1 time. So, but we thought we need to go ahead and provide that support. So, oh, I keep forgetting this. So this is our data. So youth between the ages of 14 through 18, we had 27 youth that completed the group. So what we found is that most of the young people actually wanted to continue with the groups, and a number of them ended up preferring the offline format, which I think is just an interesting in thinking about the ways that we offer services in the future, and thinking about this sort of this planning ahead model that I think this webinar series is really based on. This has now become, we now have 7 groups that have launched that are online only. This is now becoming a regular part of our programming and a regular part of our trial. It certainly increases access. Ontario is has a lot of rural parts, so it really increases access for young people. And we found that in many cases it works, even though some of our old school clinical mentality was like, we don't know if we can do this. Can we do clinical work online? And what we found, and we'll learn from certainly the wonderful Sarah and Coley in a minute, is this really can be done effectively online. And it's good to think about as something that we can do, because we often have some anxiety about it. So just in terms of the young people that, just so you know who we're kind of dealing with, our Our categories for all of the identities are not mutually exclusive. Our goal in working with community-based agencies and running community-based agencies in the past is we need to have something effective that works for everybody that walks through the door. So the majority of these young people many were currently in school, so then they moved out of school, which I'll talk about in a minute. And the average age was about 16. And you see the range of identities that we had for folks here. We had a fairly large number of Indigenous youth, which is great, and something that we're increasingly seeing in a number of our programs as well. These are the range of identities that we have in terms of gender identity. So you'll see we had a high number of folks that identified as trans in some way or non-binary, and a number of folks that identified really as bisexual or pansexual. So along the fluid, with a number of different fluid identities. So I think that's something important to note in terms of certainly the way that we capture data and then the way we think about program development. We really think it's important to be as inclusive as possible. So what we see here, and I won't bore you too much, but this is what's exciting to me. So it's great to have a good idea. It's good to provide support. It's good to feel great about it. It's also really helpful to see the data to see that it works. So again, this is 27 young people, but that's a fairly good for our pivot online, and the majority of the groups are online. So what we see is statistically significant, which we want to see, and you can just see from these arrows that things are all going in the direction that they should go, and this slide is all statistically significant. So these are all the different ways that they learn to appraise stress, which is tied to coping. They learn to appraise stress as a challenge instead of a threat, which we know leads to better mental health, particularly when that's altered in adolescence all the way through adulthood. And we didn't know if we would find this given the stresses of the pandemic. So that was really exciting. And the idea that they have enough resources and support to meet the challenges that stress is bringing to them is also really positive. A number of different measures of coping, receiving emotional and instrumental support, learning how to positive reframe, learning how to plan. And then what we have, these are all in the right direction, not statistically significant, but I think just interesting to see. We saw an almost, which doesn't really count, but an almost statistically significant reduction in depression, which is really shocking because we are generally seeing depression increase because of the pandemic. And of course, LGBT youth have higher rates of depression anyway, as again, I think was so articulately mentioned. And we are seeing increases in hope, not quite as high as we see when it's the offline only, but actually given the pandemic and the isolation that the young people were feeling, we do feel pretty excited about this. So we can now think about what this means for our ongoing offline groups. So, and we do have a lot of data, which I won't necessarily talk about because we have a lot of other great folks that will be talking about this, particularly Coley and Sarah. But we have a lot of great data about how the COVID pandemic impacted young people and then how participating in the online Affirm group impacted. What we did see was that visually, being able to see people virtually or visually, so kind of how we are for the most part now, was a really important part of the engagement. And being able to share in those experiences was really important. Now, we did do a lot of training with our facilitators, and our facilitators really worked on creating sort of almost like a wraparound support for these young people in wanting to make sure that they were okay and moving through the COVID. Well, we're still in it up here, but moving into some of the unknowns related to COVID, but also feeling as comfortable and as stable as possible. And we do also have, and I think probably Coley and Sarah will also talk about this as well, but just in terms of the clinical tips. And I think also Angela talked a lot about these. But what we learned big picture is you can do really great clinical work online that has an impact on mental health, that youth are feeling engaged, that help you feel engaged. And so that's our big picture, right? Now, the tweaks of how to do that with the platform are, again, we've heard some about this. We did use Zoom because the The encryption continues to improve, and it is what young people feel the most comfortable with. And so we use Zoom. That seemed to work fairly well. We did find there was initial anxiety with both the facilitators as well as the young people. As we were particularly authentic, as we really set up the ground rules, this is what we need to make sure that this is a confidential group. This is what we need. What do we all need? How do we share? Do we do little breakout chat rooms? Do we use virtual screen share? What do we do to make sure this is engaging as possible? Even the basic clinical tips of leaning in are really important, and young people responded to that to help them feel heard, right? As a facilitator, you do have to be sometimes a little bit more engaged and very prepared. You really have to plan, I think, for how you will increase engagement all the way through, particularly, I think, for anything, honestly, online, but particularly for some of these clinical groups, because your job is essentially to help them feel heard and affirmed and help them engage in the way that makes sense to them. So it could be through chat if they don't feel comfortable talking. We do require that there is a visual of them the majority of the time. We understand that can be challenging for folks, but that's really for the confidentiality piece, so that the other young people feel safe, that it isn't somebody else listening that they don't know, and they feel much more comfortable in that way. So there's some things that we've learned as we've gone along. And using the platform again to engage as much as possible. We do lots of clapping. It's either virtual clapping or clapping like this. We give lots of thumbs up. Zoom doesn't give us a lot of different ways to do that yet. Hopefully that will improve. And then we did certainly increase. The only other thing I wanted to mention was we really increased the amount of support we were providing between sessions, because we wanted to make sure that we weren't seeing them in person. We wanted to make sure we know there's heightened risk of abuse, like we talked about. And so we checked in with them. So we sent whatever we had approval from them to use. We sometimes texted them, we sometimes emailed. We were basically really asked them to check in and let us know how they were. So it's a little bit of an additional work, for the facilitators, but much more important. And I really think it helped the young people feel engaged and supported. So we're pretty happy about this. And again, the shout out goes always, the hard work is really the folks who are doing the bulk of the facilitation. And they've done a really good job here. But we also found just generally that for the young people, the COVID in some ways was challenging because they were in the house with the people who may not be that particularly supportive for them. We were sometimes able to help them figure out another place to go. But for many of them, they were much less stressed because of the fact they didn't have to go to school. And so many negative things. They get bullied at school. They're very stressed. So it was really more of a mixed bag, I have to say, than we thought in terms of the impact that COVID was having. So I think it really helps us to think about adjusting the way that we do our work and really responding to young people. And for us, it was also to not be afraid to try it. Be really authentic about, okay, look, we're trying to figure this out. Let's figure out how it can work for everyone, and not worrying about being too perfect, although my facilitators are of course perfect, but and really making sure that that the young people are able to feel seen and heard. So now we have, again, a number of folks who want to be ambassadors specifically for the Affirm online program, as we're able to extend it out. So you all may be doing it already, but we're really excited. Even something as clinical as CBT can be done effectively online.
Thank you, Shelley. I think all of that's really exciting because so much of what I've heard over the last few months has been folks who are really nervous about whether this is going to work and whether it's going to have any positive effect on their population. And so I think it's really positive that you have this data for us. We have one question from Janelle Kelly that just asked if you could explain what the HOPE pathway was.
Sure. And yes, certainly, let's take down the slide. Sorry about that. So HOPE is really, so what we found in previous research in the literature is that HOPE is really, the cultivation of HOPE is something that reduces suicidality for adolescent populations, particularly trans and gender nonconforming populations, but for a lot of adolescents and a lot of folks within the LGBT umbrella. And so hope for us is really the underpinnings of hope in the ways that we're thinking about this construct is whether or not I can see my way forward in having a future, right? Which of course would be the inverse of suicidality. And so there's a number of measures that talk about sort of the pathway. So it's kind of like a pathway forward. Can I see myself moving forward? And hope, and the idea of hope, there's another piece of it, which is this idea of agency, which ties into sort of coping, planning. So do I have the ability, if I see this pathway, do I feel like I have the ability or the self-efficacy or the sense of agency to move myself along this pathway? And if not, or if I can, what kind of supports do I need to continue to move along the pathway? So it's really just the vision for the future. We're also trying to cultivate, certainly within a lot of CBT interventions. That's a really important piece of sort of the goal setting and thinking about the future, but particularly around Affirm, because we know that hopelessness is really, really tied to suicidality, and we know the rate of suicidality. We really want to cultivate that sense of hope so that they feel like there's a future for them in a world in which they may not see themselves as having a future. It's a great question, though.
Thank you, Shelley. And just one more question about Affirm. So if folks wanted to know how to bring Affirm to their agencies or how to get young people signed up into an Affirm session, I did post your website into the chat, but is that the best way to find that information, is going through the website?
Yeah, and I think you could also just email me directly. We're just in the process of redoing our website, so there may be a few things that aren't working. So you feel free to just reach out to me directly, and I can also get back to you. Thank you.
We'll be sure to share your email through the chat, so be on the lookout for that, folks. Just another note, we've had a few people ask for different resources as we've been discussing. Thank you, Cynthia Alvarez, for your comment as well. And so Allison from HRC is here and has posted a link to some resources that HRC compiled. So Allison, if you could post that one more time. And then towards the end of the session, Allison will talk a little bit about some of those resources that are available. I also see a lot of participants who've been putting information about some of the resources they've heard of or they know are launching online. So keep that list going. If you know of a particular program or a great resource to share with the group, please do put that in the chat. And particularly June is Pride Month. And so I know lots of virtual prides are happening and people are trying to connect with each other virtually. So if we could get some of those links in the chat too, that'd be great if you know of any virtual Pride sessions. So again, thanks, Shelley, for talking about the data and the intervention. Now I'd really love to turn this to Coley and Sarah from Pittsburgh, who actually are running these interventions not only with youth, but also with caregivers. And so Coley, I'll turn to you next. If you could talk about the experience in providing this to young people, that would be great.
Yeah, so it has definitely been an experience. Just for background for everyone else, we had a session of Affirm that was going on, and right when everything stopped in Pittsburgh, we had one more session to go. So that was actually our first virtual session, which was just finishing off an in-person session, and actually finished off okay. Turns out half of the youth who were present weren't even in their homes. They were actually, out of town or with family members that they normally don't live with. So that was different, and a lot of the concerns that we had around confidentiality and technology did come up then. So when we were able to launch our fully virtual version of Affirm, we were able to take that a little bit of knowledge there and apply that. So some of the things that we found that have been super successful with the virtual rollout have been having a weekly snack delivery. It seems small and silly, but really, one, it's a good way of getting materials out so everyone has a workbook. But, they know that they're, we're thinking about them, whether it's, chips and Oreos, just, a couple small snacks that they normally would have in session. It just helps keep them connected. And similarly, iPad delivery and headphones for youth who don't have that technology. And like we were mentioning earlier too, being able to ask those questions before the session rolls out, like, do you have reliable internet access? Because if you don't, we do have cellular enabled iPads. So knowing what would be the most useful technology to deliver. And that does add about another week of planning, just as far as making sure everyone has the technology before you just roll out like, oh, you didn't have it? I will make a note quickly there before I forget. Several youth actually prefer using their cell phones. So if they have smartphones, some youth were just like, I don't want a tablet. I want to use my phone, which I thought was odd because I would want a free tablet, but I mean, that's me. We were able to shorten the sessions from 8 weeks to 6 weeks. So instead of 8 sessions, we were able to shorten it to 6 sessions. And that's been super helpful because 8 sessions seems a bit daunting in this time. And also one of the other things that we did, we decided to host during the daytime to hopefully, for people who have parents or other people in the household, hopefully that they would be leaving for their day jobs, if we prioritize using daytime hours as opposed to evening or early morning. For some youth, it does work out. For other youth, they had to move to a different space in order to have privacy. And sorry, I did say one more thing. Lastly, another thing that's super helpful was having, I think Shelly already mentioned this, but having that additional support. So a lot of youth who were participating in the virtual only session of Affirm did ask, Coley, could we have a one-on-one, or, is there another way I can connect to youth in between times that we're having Affirm sessions? So we were able to add that in what we already do at Hugh Lane, but that's just a heads up for other agencies that may not be as flexible. So I do have windows that youth can actually schedule themselves in my calendar from 11 a.m. to 4 p.m. on Thursdays. So they're able to just go in there and take up their own time slot, and I set up a Zoom. And also we have a Discord that we monitor 2 times a week from 3 to 5 p.m. on Tuesdays and Thursdays. So that is a lot, but I'm open for questions too.
Great, thanks, Coley. Have the young people who've been participating in your intervention, have they brought up sort of just all of the stress that's been going on right now? Is that something that you find yourself talking about in these sessions?
Absolutely. I think I talked to Shelly and Ashley about this before, but it feels like they're grieving a lot. They're missing a lot of opportunities, especially my youth who are seniors this year, not being able to walk, not being able to go to prom, things like that. And even though these are youth that, might have been kind of like, oh, I don't want to go to that event, but the idea of not even being able to have the option of saying, no, I don't want to, and having it taken away from you, they're definitely mourning a lot. And that's just with their everyday lives. On top of, if you already don't really get along with your siblings or other household members, and now you're stuck in the house with them for a lot longer than you normally would be. And then, of course, the fear of the virus. So there are a lot of youth who are like, well, I could go outside, but I'm very afraid, and, that fearfulness. And then, of course, the, I guess response to police violence, and youth are, these are youth who, especially if they're a youth of color or Black youth, they were already fearful of police before, like all of this kind of came to a head. But now, they feel, on one hand, there's a little bit of fear as far as like, I want to participate, but I don't want to get exposed to the virus. And the other fear is that, it's not even a fear, sorry. The other thing is they feel hurt. They've been saying for years, I've been followed in stores, I've been treated poorly, and people are like, oh, you're making that up, or it's not that bad. And now people are actually saying like, oh no, like this is your daily life. And now they're like, yeah, I've been saying this for a long time and you didn't believe me. And now you're saying it and now you believe.
Right, it's a lot definitely seems like a lot to take on for sure. And I'm watching the chat too right now, and it seems like there's a lot of conversation around bullying. So Shelly had mentioned that bullying in schools is maybe not so much a thing anymore, but folks in the chat are saying that their young people are experiencing more online bullying. I don't know if that's come up in your sessions, Coley, or if anybody else wants to jump in about how we might support young people around that.
The youth that I work with in particular, online bullying isn't as big for them when they're not in school, because usually school is the place where it starts and it continues online, versus now where it's just like, I have to actively go out and find people to harass, and that takes a lot more of my energy than I normally would be able to. So it was just like, oh, that person I don't like is walking the fifth period, let's harass them. It's, you know, so I'm not saying it doesn't happen, but I think a lot of it has been also too that a lot of my youth that I'm, you know, used to hanging out with and seeing, they've actually pulled back a lot from online spaces and communities. So if anything, I feel like a lot of it's been more isolation and withdrawal. But for sure, you know, cyberbullying is a thing. And I will say it's not common with the youth that I serve, but one thing that makes young people very fearful is doxing. And that's when you're posting like address or, you know, personal information where people can be found online and encouraging strangers to go harass that person. It's almost like an amplified and very scary version of, if you're older or my age or older, you might remember like someone writing a phone number on a bathroom mirror, like, ooh, for a good time, call this number. But imagine that times 10, you know, with all of your other information. So I have seen that happen, but again, not personally to my youth.
Right. I mean, that's a great ad. And I'm also seeing some folks are posting some cyberbullying resources for each other in the chat too. So thank you for doing that. I don't know if did anyone want to add anything else to that, that thought around cyberbullying? Okay, well, the resources, there seem to be a few of them, so definitely check those out. And I also, the first thing that I think of is just having conversations with young people that are enrolled in our services around whether they're experiencing those things, and also what are some things they can do to avoid or deflect and sort of do their own self-care around just all the stressors they're experiencing. I heard this great presentation the other day that encouraged everyone to go a step further than asking, how are you doing? Because the default answer for a lot of people is, oh, I'm doing okay. But go a step further to ask whether people are experiencing things, and these things in particular, so that you can dive a little deeper in with them and be able to provide more appropriate supports. So thank you so much, Coley, for your thoughts. And Sarah, I'd love to pass it to you now and hear a little bit about how your experience has been providing services to families and caregivers virtually.
Yeah, thanks. So we facilitate both sides of the Affirm intervention, so Affirm for Youth and Affirm Caregiver. And so we have now facilitated our second full cohort of caregivers interested in this series. And so we have been very excited in a number of ways to see the reactions from caregivers who want to engage in this work in this time, because at first when we thought like, oh, we should transition to virtual services, how will this play out? We had sort of assumed that since caregivers had been taking such an enhanced role in the lives of their youth in all other aspects, whether it's teacher or social network or everything else during this time, we weren't necessarily sure how much capacity they would have to participate in a training and intervention. But we've actually seen the opposite. We've seen a huge increase in the number of interested participants, so much so that we've moved to a monthly virtual format. And so we continue to reach capacity for each of those cohorts each month, and we will continue to provide as many opportunities as we can for caregivers. And so some of the things that we found that were really important are that caregivers still needed and found the evening timeframe most helpful. So we run those virtual sessions from 6 to 8 p.m. at night to try to fit in the after dinner time, but not too late. We also have adapted the format. So typically when we're implementing this in person, we do 3 weeks in a row, 3 3-hour sessions, but 3 hours of Zoom is way too much, especially for in-depth, like facilitated CBT-based support group conversations. It's too much. And so we had to reduce that to 4 sessions. And so now we're doing 4 weeks in a row, 2 hours each week to be able to cover the content of the series. And I will say that there were some things that we were nervous about up front, like I was concerned about how engaged people would be or how much participation there would be. But I would actually say that people are more comfortable participating from their homes. It reduces the stress of having to travel somewhere, maybe somewhere that they're not familiar with, to an environment with other people that they may or may not know. And so the ability for them to participate from their homes and be able to incorporate this into their routine has been really helpful for them. And so we've seen an increase in the number of people who are sharing answers and diving into the work and engaging in the activities. And so we do also provide deliveries for caregivers. I will say that we do not provide weekly deliveries for caregivers. So we do one at the beginning and one at the end, but we still provide snacks and workbooks and incentives. And it really helps to keep them engaged and to feel appreciated and feel like they want to log in and join us. We did have to give everybody an overview of Zoom and sort of Zoom functionality at the beginning. And so there was a little bit of a learning curve around like, hey, if you and your spouse are both participating in this, remember that you both have to be on mute because there's going to be a lot of feedback if you're sitting on your phone in the same room, and that's not going to go well. And so we've been able to navigate that. But, you know, by week 2, week 3, the technology components run a little bit more smoothly, and that's really when we have more of the community discussion and feedback and engagement in a variety of activities. And so I see a question that says, how do you provide a snack if it's online? We're personally delivering those snacks. And so what we do is we get the addresses from the participants, and then our team puts together some, you know, Girl Scout cookies that we've gotten donated, or like Coley said, chips, snacks, Oreos, whatever it is. We just provide a couple of things in a box with the workbooks that are required for the Affirm intervention, and then we drive them to the participants' houses. And so we do a no contact delivery to maintain everybody's safety. We give them a time frame and a window where we're dropping them off, and then we move from there. And then we work with our partner agencies as well. And so if somebody's a little bit far for us, we either use priority mail or we use agency or partner that is closer to the family, because some of the families are 2 or 3 hours away from us. I'm in Pittsburgh, and so we can't go that far, unfortunately, to be able to deliver stuff, but we do find other ways to be able to do that. And so it's been surprising to us to see, again, the number of family members who report that they feel very supported during this. One of the other interesting components is that while we are having such an important conversation about racism and systemic racism in all of our systems of care, whether we're talking about child welfare or schools, and particularly justice systems and the police, that these are things that are really important to embed in this content as well. Affirm already has some components of intersectionality and understanding the importance of that when we're discussing minority stress and how to support LGBTQ youth. But it's really important for the, you know, for if you're considering doing this work, to lean in with families and encourage them to have both of these conversations with youth that they're serving, and really highlight that, you know, while some of these experiences impact LGBTQ youth, they also impact youth of color, and how are we going to show up in both of those spaces? And then I want to say one more thing about youth that I wanted to add about some of the supports that we're providing as a consideration. So with youth in congregate care settings, we've actually been able to support youth in congregate care more now virtually than we had previously, because there's always an issue with transportation. It's very hard to be able to support youth in residential care settings to be able to come to the various locations that we would set up for Affirm. And so now this provides an opportunity, and especially with access to technology, we've been able to reach this group. And so we know LGBTQ youth are overrepresented in care settings. And so it's been a great opportunity for us to do that. And the other thing that my team is amazing. Thomas and Coley should get all of the credit in the world, because they were with us, and we woke up one morning, we were like, we're going to do this, we're going to transition everything, and we're going to do it today. And they were like, yes, let's do it. And so that spirit is really important. But I want to say that part of what they did in the beginning was helpful in that engagement piece. It wasn't just enough to post on social media. It wasn't just enough to send an email or a flyer out and say, hey, join us for this social online group and hopefully you'll come. They set up one-to-one chats with youth before they even registered to participate, to introduce themselves, to introduce the intervention, much like we would do for an in-person activity. And that really made a difference in getting people engaged. We still see youth come in and out. We still see some drop-off. That it's no different than in person, but those setting up that one-to-one in the beginning was really pivotal for getting people interested and feeling safe when they weren't able to check it out in person. And some of that applies to caregivers as well, but it was much more important on the youth side of Affirm.
Great, thanks, Sarah. So I'm hearing lots of stuff. I'm hearing that you all really, you and your team really thought about what does engagement look like in this time, and how do we like step it up a little bit to keep people engaged in this virtual world. But I'm also hearing that you're able to provide more services to young people because you can broaden out that net a little bit and catch those folks that may not have been able to participate because of travel issues, right? Or not being able to transport. I also think that's the case for LGBTQ youth in rural communities. I've heard so often people being really worried that those young people and those families that are in those rural communities don't have access to a big LGBT center where they can get these services, right? And so it's very hard to deliver services to those communities. So virtual work provides that opportunity to provide that, which is really exciting. And it's really exciting to hear that you're able to provide more services to young people in congregate care, because that continues to be an issue on so many fronts. We had a question about the frequency of sessions. So this is actually, I'm going to throw this to Coley. You mentioned that you all adjusted how many sessions you were doing for the intervention, I think from 8 weeks to 6 weeks, right? Is that correct? And so do you feel like it had the same impact even though you shifted how many times you were meeting?
Yeah, I definitely feel like it had an impact. I will say I had an even more aggressive idea. I planned to have Mondays and Wednesdays, so it would have been knocked out in 3 weeks. And that was way too aggressive. That was like way too much affirm, 1 week. That's okay. So we ended up stretching it out to still 6 separate weeks, once per week. I do think that it's helpful. There are a lot of topics that we were able to condense a little bit. And we also, like under the guidance of Shelly and Ashley, I was able to like move some things around. For example, the Hope Box is a really cool activity, but it's hard to kind of put your head around virtually only. So I introduced the Hope Box a lot earlier, just so you have an idea of what one could look like, what you might want to put in it. So they're not just put on the spot like, all right, get your box together. Whereas in person, it's easier to do that because I can just say, bring some trinkets and things that are sentimental to you, and we can work on it together.
That's great. That's great. Thank you. So we did have a couple of things I just wanted to shout out from the chat box. One, Animal Crossing is trending in the chat box. If you haven't taken a look at that conversation, it's a good one and a great resource too. And then some folks have asked if it was possible to bring youth onto this panel to speak. And so we definitely reached out to the young people we work with to jump into this conversation. We were putting this panel together right as protests were picking up for racial justice or, in response to the injustice that we were seeing. And so many young people that we had engaged initially were like, I'm going to have to back out of this discussion because I have other things on my plate. But it certainly is something that we're going to continue to try to bring and put together as time goes on some sort of panel that they can contribute to as well to answer that question. So thank you all for posing that in the chat. Great, so thank you, Sarah and Coley, for all that Affirm information. I'll just add one thing that I think is really interesting in that some folks from our sites have also said a benefit to virtual work is that they're seeing that caregivers are opening up a little bit more than they would in in-person settings, and that on the phone, it sort of seems like they're in their environment, they're in their home and safe place, and there's some physical distance. So they feel a little bit more comfortable opening up about really vulnerable things, which is something I hadn't anticipated when we first jumped into the virtual world. But I guess that phone conversation sometimes is providing some space for caregivers to talk about the things that may be really bothering them, but not necessarily be in that sort of awkward chair across from the clinician or the service provider. So that's also something we're seeing when we're working with families. So I am going to throw it to Allison next. Allison, your organization has just responded really swiftly to the call for virtual resources and different tips for working with people virtually. So can you just talk a little bit about that?
Sure. Hi, everyone. It's good to be connected today. I'm Allison, she, her pronouns, Director of All Children, All Families at HRC. So yeah, we are a national organization here in DC, and unlike many of my expert colleagues on the panel, we're not in direct service with community, but we are, I'm part of the public education side of HRC, where we do a lot of advocacy and education and awareness building Specifically, I work on a program that works with child welfare organizations around institutional change and how to create an affirming environment for LGBTQ young people and LGBTQ adults. But often what we're doing is learning from you all and compiling those lessons learned into, what we hope are digestible tip sheets and best practice guidelines. So I've chatted out several of them for you to take a look at that we've developed with partners like the School Social Work Association of America, the National Education Association, American School Counselors Association. A lot of our national partners were really excited to help the urgent needs for some considerations around the impact of COVID on LGBTQ youth in particular. So check those out, and because obviously this conversation goes beyond this 90-minute webinar, and we just want you to know there's a lot out there for your ongoing learning. In addition to those types of tip sheets that we put together, we also have a research brief that HRC released early-ish on and during the pandemic around the specific impact of COVID on LGBTQ communities and the way in which the community is uniquely impacted. Some stats there, and thank you to Sarah for sending that out. Around, for example, percentage of LGBTQ folks in the jobs that are most impacted right now and most likely to be experiencing either unemployment or underemployment. So if you or others that you work with want to learn more, check that out. So that's the role we've been doing, also pulling that compilation of virtual supports together that I sent out. Great resources like Trevor Project, Q Chat Space, which many are shouting out to, and actually the director of that program is on today. So if you have more questions about Q Chat or any of those virtual supports, I'm sure Deborah would be more than happy to answer those in the chat. And the tip sheets that we put together cover things like, creating an affirming virtual space, anticipating some unique challenges around confidentiality and privacy, a lot of what's already been discussed, as well as, being mindful around unique challenges if the young person is in a home setting where the caregivers are not affirming. And so a lot of what's been touched on. And so if you want to learn more or you want to share with your colleagues to make sure that they're thinking about all of this as well, you can do that. You can share that information. And then the other thing that maybe of interest to folks that we've done is a good amount of, and others I know on this line, good amount of work of adapting staff training and professional development resources to an online environment as well. So obviously we're all navigating these unique challenges for ensuring safety and well-being for LGBTQ youth during COVID, while also still trying to build a culturally responsive staff group, right, or workforce. And so we've managed to fully adapt one of our day-long trainings to Zoom setting and went through a process of kind of considering what aspects of this training can be readily adapted to a Zoom setting, really understanding Zoom's functionality, and reworking the training, figuring out new ways to do exercises and piloting it and some lessons learned. So I'd be interested in the chat too if anyone else is figuring out how do you deliver LGBTQ content and continue to build your staff or your colleagues' skills and knowledge in this area virtually. Feel free to share any lessons learned or questions in the chat as well. And yeah, so that's what I had, just a few shout outs to my colleagues thank you for all the great tips that you've shared throughout the panel. And I think at this point, Angela would probably open it up for more questions, yeah?
Yes, that's great. So yes, please do type in any questions that you all have that we haven't caught yet into the chat. We have plenty of time to answer them. And I just want to shout out Deborah Levine, who has been popping in resources into the chat for folks as well, and has said that if anyone has any questions about the Q Chat space, it's a great place for young people to connect and stay connected, and Deborah's offered their time to answer questions about that. So we will be compiling a big list of all these great resources for folks and sending them out afterwards, because I know people have just been furiously putting them into the chat, so thank you so much. So everyone will get a comprehensive list of those sent with the follow-up materials. Anyone from the panel have any closing thoughts that they want to share with the group? So I'll just say that, the big pieces for me, To summarize the discussion today is that the virtual, the pandemic and everything that we've been going through has provided some challenges and forcing us to figure out how to provide more flexible services. How do we make sure that folks have access to us, right? Which is a challenge, but is also actually a really great opportunity. And I think that we've seen that through our work by expanding what we provide. We've actually been able to serve people who we would have never been able to before. And, Shelley's data and Coley and Sarah's experience show that there's promise in this. This is, the virtual world of service provision is showing promise, and there's some good data to support that, which is really exciting. Pieces to consider specifically for LGBTQ youth is if you're not having conversations about LGBTQ identities with your LGBTQ youth, please check in on them because they may be struggling through some stuff that they're just not bringing up, especially if they're in homes where they're disconnected from support or affirmation. So check in on that specifically. If you have Black LGBTQ youth that you're serving, check in on how they're feeling given everything that they're witnessing right now. There's a lot of excitement with the social justice movement that's happening right now, racial justice movement, but there's also things that are coming up that can definitely be more, definitely more stress on our Black LGBTQ youth, but there's things circulating about LGBTQ Black folks being attacked while they're at rallies and that kind of thing. So just check in on those youth and make sure that they're okay and that they have the appropriate resources. Checking in about confidentiality and privacy when we're in these virtual spaces, it looks different. We no longer know who's around the corner from the young person as they're engaging in telehealth and teleservices. So I think those are big pieces that we've been thinking through, and hopefully, talking about it is helpful here for you folks. I don't see that we have any other questions coming into the chat. Any other things from our panelists before we close out for the day? Okay, well, I want to thank our panelists for all their time, and just on behalf of the University of Maryland and the TA Network, I just want to thank everyone for participating today. The panelists and all of your active sharing in the chat have made this conversation worthwhile, and I appreciate that. Together, we're really showing that we can create a way forward and do it with strength. And so please continue to take care of yourselves and take care of others, and know that you will get a full resource list from us and all follow-up materials shortly. So thanks, everyone.